The idea of shoulder health. So what are some good shoulder health exercises? External rotation. What does external rotations do? And why do I want to do external rotations on our upper body push-pull day? The main muscles involved in pressing. Pecs and deltoids. If we understand the attachment point, we have our sternal portion and our clavicular portion. So that's the origin. And they attach right here at the front of the humerus. And when they contract, what's the action they cause? Flexion, horizontal adduction, internal rotation. And if there's no opposing muscles, dislocation. But we do have opposing muscles. That's why it's good to train them as well. So that's what it means to have stabilizers, opposing muscles that stabilize the joint. So therefore, our heavy pressing leaves us internally rotated. Now let's think about our biggest muscles that we train on our pull-ups, pull-downs and rows. What are they? The lats. Where do the lats attach? Top of the pelvis, through thoracolumbar fascia, come up underneath the arm and attach to the front of the humerus. Lats, inner lip of the bicipital groove, pecs, outer lip of the bicipital groove. Both of them, when they contract, they pull those two bones together. So from the pelvis to the front of the humerus, pulls that together and creates what? So there's a few actions. Shoulder joint extension, adduction, and internal rotation. Okay, so we've done our push-pull ratio of 1:1, which leaves us balanced, but how else does that leave us? Internally rotated. So this is why a rehabilitation protocol for most people is to include external rotation exercises. What are the muscles that externally rotate the shoulder? It's not just the rotator cuff. What are the three muscles that externally rotate the shoulder? Infraspinatus, teres minor, not major. Teres major is lats little helper. It does the same things that lats do, pretty much. And that's not a rotator cuff muscle. So teres minor and infraspinatus, as well as the posterior fibers of the deltoid. So think of the size difference of those little muscles compared to the big lats and the big pecs. So that's a good reason to include some external rotation exercises. No, you can't load them with heavy weights. And there's always going to be some type of an imbalance, especially when you consider the size. Okay, but that's why we train external rotators. And it's not just rotator cuff, it's external rotators. So when we do rotator cuff, let's think about where the rotator cuff is. What bone does the rotator cuff sit on? Scapula. Let's think about the scapula. How many rotator cuff muscles are there? 4. Here's an acronym for you to remember. SITS. Let's go through all of them. So this is the spine of the scapula. Superior to the spine of the scapula sits what? Supraspinatus. Inferior to the spine of the scapula sits what? Infraspinatus. Underneath that is the teres minor. And underneath the scapula, the way that we remember this, just like underneath the water, sits what? Submarine. So subscapularis. Okay, so supraspinatus, infraspinatus, teres minor, subscapularis sits. They are not all external rotators. They all have different individual functions, which I'll go through, but they all have one main function. The individual function, what we need to consider when we understand a muscle's job is to get the attachment points, the origin and insertion. When the muscles contract, it pulls those 2 points together. So when we think of the origin of all of these muscles, it's the scapula. So the origin of the infraspinatus and teres minor is here, and it attaches right here on the humerus. Okay, so when those muscles contract, infraspinatus and teres minor, it pulls those two parts together, creating what? External rotation. Now let's have a look at the muscle that sits superior to the spine of the scapula, which is what? Supraspinatus. Okay, it passes through under the acromion and attaches at the top of the humerus here, or the side of the humerus, I should say. And when that muscle contracts, what action does it create? Abduction. Then we go to the subscapularis, which sits under the scapula, kind of under the armpit like this, and attaches to the front of the humerus. And when that muscle contracts, what action does it create? Internal rotation. Great. Now here's the thing with the rotator cuff muscles. Okay, the best job for the rotator cuff muscles to do isn't external rotation, abduction, internal rotation. Yes, it does that. But their main role is to work together to stabilize the head of the humerus. Okay, so that's the ball inside the center of the glenoid fossa, or the socket. So it remains in the center, so the big pushing and pulling muscles, the big pecs, lats, deltoids, can do all sorts of amazing things, pushing, punching, throwing, and all of these things. And the rotator cuff muscle keep the head of the humerus inside the center of that glenoid fossa, or the head of the ball inside of the center of the socket. Now, what's the problem with shoulder health and blaming the rotator cuff on every shoulder problem, which is a very common thing? A lot of people have strong rotator cuff muscles. The scapula moves around a lot. For the rotator cuff to do its job correctly in holding the head of the humerus in place, it needs a very stable base of support. So the scapula moves around a lot, and we need to use our strong muscles to keep it in place, to stabilize that bone. What are the muscles that stabilize that scapula? All the muscles that attach to it. What are those? Those mid-back muscles, what are they? Trapezius and rhomboids. Okay, we've got other muscles that attach to it as well. Levator scapula, What does the levator scapula do? Elevates, yeah, so shrugs. Okay, we've got our biceps attached to the scapula, our triceps attached to the scapula, a few other muscles attached to the scapula, they will stabilize it as well. Underneath the scapula, okay, there's a muscle that holds that scapula in place. What's that? It also protracts the scapula, serratus anterior. Okay, so we can have the strongest rotator cuff muscles in the world, but if those muscles that attach to it aren't doing their job in stabilizing that scapula, the shoulder pain isn't coming from a weak rotator cuff. And in fact, a lot of people are weak in certain areas like serratus anterior and our mid-back muscles. Because most people do things like work in an office all day where our scapulas are protracted, which stretch the hell out of those middle and lower trapezius and our mid-back muscles. And they end up being weak and causing shoulder pain. Yeah, cool. We've got shoulder health exercises, external rotation. Fantastic. What else can we consider for healthy shoulders? Strong mid-back muscles. Okay, strong serratus anterior. How do we strengthen those? Rows, pull-ups and pull-downs performed correctly. So why do I say performed correctly? General population lifter who sits in front of a computer all day long that has this posture with stretched mid-back muscles, rounded shoulders, protracted scapula. How do they perform their rows, pull-ups and pull-downs? They don't use those muscles. They've trained themselves not to use all day long. So those individuals need to be educated on how to retract and depress the scapulas, which is the actions of those mid-back muscles. So don't just write a program where we say, go and do rows and pull-ups and pull-downs, and that'll fix your shoulders. Those individuals need to be taught how to use their rhomboids and trapezius correctly. Okay? So that's why I look for those cues with my rows, pull-ups and pull-downs. Full stretch, where the scapulas protract and elevate, and then a full contraction where the scapula retracts and depresses. This is the best exercise that we have for those mid-back muscles. Yes, we have isolation exercises to target those as well. Like what? Face pulls, great exercises. What about the serratus anterior? What are some fantastic exercises for serratus anterior? Great, so we've got serratus anterior raise. People call it a liberty raise, standing like the Statue of Liberty, right? Where I like to kind of push the arm about 45 degrees, reaching out with like a dumbbell. Okay, so this is the action that I'm creating here at that scapula is what? Protraction, which is one of the actions of the serratus anterior. What's another way of strengthening serratus anterior? Other great exercise for serratus anterior, protraction push-ups. So doing a push-up and then not just finishing with the elbows locked, emphasizing the protraction component. Same with dips, protraction dips. Flies will protract the scapula, okay? And so will all of our dumbbell pressing on all angles. Dumbbell presses on all angles strengthen the hell out of the serratus anterior. So yes, we've got some amazing isolation exercises, but don't look past those compound movements performed correctly. Remember the idea